Professional responses to domestic abuse. The role of multi-agency cooperation. Rita is 33 years old and lives together with Max in an apartment. They have been a couple for 2 years. Neither Max nor Rita has any children. Rita is getting increasingly frightened of Max's behavior. He keeps telling her that she is too fat and forbids her to wear certain clothes. Regularly, he checks her cell phone to see with whom she has been in contact or if she bought anything online. Eventually, he shouts at her and slaps her to make her do what he wants. One night, he suddenly becomes very angry. He starts to throw things at Rita and to push her very hard in the stomach with his fist. Rita gets hurt. She feels very sick with some severe pain and cramps in her stomach. Also, her heart is racing, and she feels as if she could faint any moment. Max is concerned and drives Rita to an emergency department. The physician listens to Max's description of Rita's symptoms. Max says that Rita has severe menstrual pain, which she has now and then. The doctor examines Rita. Max promises to consult with Rita, a gynecologist, the next day and to come back if the situation worsens. The doctor prescribes Rita some medication. How could this be done differently? Let's film the scene again. At the emergency room of the hospital, a physician listens to Max's description of Rita's symptoms. Because Max is talking instead of Rita, the physician gets suspicious and takes Rita into a separate room without Max to do a medical examination. The physician asks Rita when her symptoms first occurred and whether she has any explanations for them. Rita avoids talking about her private situation. During the examination, Rita is still unwell and reports about strong abdominal pain. Therefore, Rita gets an ultrasound to rule out any internal injuries. A liver rupture is detected. She will need surgery and will need to stay in the hospital for a few days. Before surgery, Rita is waiting alone. The physician approaches her again and tells her that some of the patients she is seeing with this kind of surgery are being hurt by her partner. She asks her if Max had hit her and whether Rita is afraid of Max. Rita decides to disclose that Max had pushed her. The physician thanks Rita for telling her and completes her medical record. After Rita completed surgery and is doing better, the physician talks to Rita again to assess her risk of being victimized again by asking her more questions. For example, whether Max or Rita have any children, as she would need to work with Rita around safety planning for them to consider the impact of domestic abuse on them as well. Rita does not want to report to the police, as she is too afraid and insecure. But Rita gives her consent to be contacted personally by a specialized professional for such cases during her stay in hospital. According to internally defined procedures for such cases, the physician contacts a social worker specialized in the support of domestic violence victims. They talk about Rita's situation, and they agree to cooperate in this case. The physician listens to the social worker's suggestions. They discuss on the next possible steps and arrange that Max is supervised when visiting Rita while in hospital. The physician is relieved to have another expert involved in Rita's case. Rita has a short meeting with the social worker and received a small flyer with the information about support options. Rita has also agreed to be approached again by the social worker for a longer consultation. Rita is slowly recuperating from her surgery. Max behaves very affectionately and empathetic towards her. Thus, Rita's wish for a longer consultation ceases. Rita is discharged from the hospital before she can be contacted by the social worker. How could this be done differently? Let's film the scene again. Rita is slowly recuperating from her surgery. While she is still in the hospital, the physician introduces the social worker to her and informs her that the social worker is specialized in the support of domestic abuse victims. The social worker asks about more information about her life and whether she is afraid to leave Max. Rita learns more about domestic abuse and how Max used coercive control to influence her. She now understands better what has happened to her and that it is not her fault. The social worker discusses with Rita possible options to increase her security when leaving the hospital. Afterwards, the social worker informs Rita about her rights about options to move on, and about possibilities to receive practical and financial support to do so. The social worker, for example, asks Rita to document any financial abuse she has experienced over the past 2 years. Rita feels torn about hoping that Max will change and being deeply disappointed about what had happened and her fear that he will hurt her so severely again. After some time, she decides to report to the police. She tells the social worker that she does not have the courage to go through the process alone and asks the social worker for assistance and emotional support. The social worker confirms that an advocate from the NGO can accompany her in all the next steps outside the hospital and explains to her what reporting to the police will involve. A report to the police at the wrong time or in the wrong way could further jeopardize Rita's safety rather than protect her. The social worker also asks Rita whether Max consumes any substances, because this could increase the risk for further violence. Rita reports that Max now and then drinks way too much alcohol. Rita and the social worker discuss further how reporting of her case can be realized in a safe way. The social worker also plans with Rita where to stay when having left the hospital. With Rita's consent, the social worker reports back to the physician about the meeting with Rita and her decision to report to the police. With Rita's consent, the social worker also contacts an advocate from an NGO specialized on supporting victims of domestic abuse for being available for Rita after she left the hospital and to provide longer-term support if she wants. While in hospital and with her consent, the social worker initiates contact between Rita and the police. A police officer meets Rita together with the social worker and files a criminal report on the case. Rita is encouraged to find a place to stay when leaving the hospital. Although going to a shelter is possible, Rita rather arranges to stay with a friend of hers. The social worker asks Rita whether she thinks this is the end of her relationship with Max. Rita says that she does not know for sure. At the same time, she never wants to see Max again. Both the police officer and the social worker offer to work with Rita together, with other frontline responders, on safety measures around any decision to leave. The police officer explains that leaving an abuser is a high-risk situation. Just leaving her perpetrator is neither easy, nor does it imply immediate safety for Rita. Rita says that her heart is broken and cries. She says that the last violent occasion marks the end of being together with Max. Both the social worker and the police officer nod empathetically. The police officer then asks Rita if she can come to the police station within the next few days to complete the case documentation. How could this be done differently? Let's film the scene again. The police officer then asks Rita if she wants to report immediately or whether she would prefer a different time and location to complete the case documentation. As Rita wants to report immediately, the police officer collects all the available information, which involves medical reports, the social worker's reports and declarations, and Rita's declarations. Also, Max's criminal record is checked and whether he owns a gun. Together with Rita, the police officer and the social worker develop a safety plan in order to keep her safe after leaving the hospital. The plan contains support for Rita's immediate and her longer-term safety. Rita now knows what would happen, for example, if Max will approach her on the street. Later on, the police officer starts documenting the case and passing the information to the Public Prosecution Service so that a restraining order can be issued. Together, in agreement with Rita, all involved frontline responders complete the picture of the case as best as possible to bring the case to court. Rita leaves the hospital with her friend, in which house she will stay for some days. Her friend is already aware of her situation and instructed how to ensure safety of Rita and of her own. Rita has only those personal items with her that she had with her while being in hospital. All other belongings, some important documents, and her laptop are at home with Max. The social worker provides support around this and encouraged her to change all her online passwords. Rita also meets with her advocate, who is already instructed on her case by the social worker. Also, the police keep in touch with Rita. The next day, Max appears in the hospital to take Rita home, but she is not there. He is furious when no one informed him where Rita went. Also, this next day, the police approach Max to obtain his declarations on the case and to suggest him to contact perpetrator support. The police update their risk assessments with their new insights about Max. With all the information collected, a restraining order is issued against Max directly, and he is not allowed to contact Rita or get close to her. Parallel, a police officer specialized on domestic abuse also contacts Rita to follow up the situation. The police officer also offers Rita to exchange information on her case with her advocate from the NGO. Rita and the police officer agree to be in contact bi-weekly to have a short update on the risk and to check whether the current safety measures are suitable. Max's case proceeds to court. He is prosecuted, convicted, and the court issues a restraining order. An electronic device is applied to Max, preventing him from getting closer to Rita, and he is permanently monitored. Rita is able to return to her home. The advocate supports Rita during the case. All frontline responders Rita has been in contact with since her stay in hospital had emphasized that the court case would rather not solve the domestic abuse, but will be one process that contributes to longer-term safety. Rita knows that she can contact the police anytime she feels in danger. Also, the advocate keeps in touch with her and the police to identify ongoing abuse by Max during the case or during any sentence or afterwards. This is how the proceeding of a case might look like when it is based on the victim survivor's needs. Naturally, reality often turns out very differently. Nonetheless, to support and empower victim survivors to prevent them from further harm, risk assessment and interagency cooperation are inevitable. Only the consideration of many views can provide the necessary insights to comprehensively understand the situation. On this basis, victims and survivors of domestic abuse can be protected and supported best.